Well, the question is, why do we need to worry about our data being shared if it helps others with the latest research and treatment? But the problem is, do you really trust the government? I mean, do you trust Matt Hancock? As you can see, he's been opted out of government for reasons not relevant to what we're talking about. Well, if you do trust the government, that's fine. But if you don't, here's what you need to do about your data. And the option is to opt out until you feel better informed, at which point you can actually later opt back in. So here's the update. As you know, June 23rd was the deadline to opt out for data extraction to begin from July the 1st. However, there was a huge uproar about this, and this was delayed till September the 1st. Previously, it was stated that August 25th was the national deadline for opting out. Well, this is no longer the case, as according to NHS Digital, your GPs are apparently now the data controllers and can set their own deadlines for patients to opt out. However, extraction from patient records will still take place on September the 1st. So GP practices would have to apply those opt-outs to patient records, which means that even though there is no national deadline, you still need to opt out before September the 1st. My head is spinning thinking about these deadlines and non-deadlines. So if you do not opt out before September the 1st, for instance, if you decide to opt out November 25th, your data will not be shared. However, your data between September the 1st and November the 25th will be shared, and that data is non-retrievable. So if you do not want your data to be shared, you need to opt out before September the 1st. Why are GPs not supporting data sharing, you ask? Well, this is because a lot of us have been kept in the dark about this. There was little time for us to look into the plans regarding data sharing, the pros and cons, never mind having to answer any patient queries or concerns about the data grab. A lack of deadline is going to be a nightmare for plenty of GP practices, because if, for example, patients decide they want to opt out August 31st, there's no guarantee that your opt-out will be processed in time before September the 1st. So my advice is, if you do decide to opt out, then you might as well just do so now. Do not leave it last minute. And you can find the links to opt out on my description page below. So what's the difference between a Type 1 opt-out and a national data opt-out? So Type 1 opt-out prevents GP from sharing your data with NHS Digital and other organisations for any other purposes other than your direct care. To do this, you must fill a form and include other names in your household, such as your children and any adult dependents. The form for the Type 1 opt-out is on my description page. Here is an example of where your data will not be uploaded to if you do decide to opt out. So the national data opt-out involves your non-GP data, such as any hospital or clinic treatments, being used or sold for other purposes such as your direct care. I mean, for instance, NHS Digital states that they're not going to sell any of your data. However, if companies do request your data, they will charge for it. So honestly, I don't actually know what the difference is. They're still getting paid. So any of your non-GP data also covers data from any other care providers and Public Health England. If you're 13 and over, you can use the link in my description page. If you have kids 13 and under, then fill this form and email or post it back to NHS Digital. This form works for both you and your children. So what if I've already done a Type 1 opt-out before? If you've done a Type 1 data opt-out in the past, that now becomes a national data opt-out, but to make sure, you can check your status at NHS Digital. Of course, if you're not sure, you can always do another Type 1 opt-out and give it to your GP. How do I get the forms? Like I said, the links are on my description page. All the links you need are on my description page. Alternatively, you can have the forms posted by contacting the NHS Digital Contact Centre on this number, Monday to Friday, 9 AM to 9 PM, or you can send them an email. Do bear in mind that this opt-out is not to prevent information sharing between healthcare professionals in the NHS or to prevent them from accessing your medical records for your care, obviously with your consent. I hope this video is clear. If you have any questions, feel free to ask. Please share this video to anyone who needs to know more about the NHS opt-out, and feel free to subscribe to my channel.